Welcome to the first presentation on thyroid disorders. Healthy function of the thyroid is essential for pretty much every system of the body, from the skin to the heart to our brain. An estimated 20 million Americans have some form of thyroid disease. 60% of those individuals are unaware of their condition, and up to 90% of those individuals are producing antibodies to thyroid tissue, indicating an autoimmune condition. Thyroid hormone impacts the brain, the gastrointestinal tract, cardiovascular system, bone metabolism, red blood cell metabolism, the gallbladder and liver, steroid hormone production, glucose, protein and lipid metabolism, and body temperature regulation, just to name a few systems. Common thyroid problems include the following: hypothyroidism caused by pituitary dysfunction and elevated cortisol, underconversion of T4 to T3 due to inflammation or elevated cortisol, elevated thyroid-binding globulin due to high estrogen levels or low free thyroid hormone. TBG, by the way, is a protein that transports thyroid hormone through the blood. Continuing on, decreased thyroid-binding globulin due to too much free thyroid hormone, high testosterone, PCOS, and insulin resistance. And finally, thyroid resistance due to chronic stress, high cortisol, and high homocysteine. Hypothyroidism refers to decreased thyroid function, the symptoms of which include mental slowing, difficulty concentrating, dry skin, constipation, hair loss, cold feet or hands, high cholesterol, irregular menstruation, acne, diabetes, and more. Remember, every cell in the body has receptors for thyroid hormone. Thus, it is not a surprise that a cascade of detrimental disease states can proceed and result from thyroid hypofunction. As I mentioned previously, the primary drivers of hypothyroidism are elevated cortisol, so stress hormone levels in the body, as well as pituitary dysfunction. That being said, we must also consider chronic infections such as mold exposure or environmental toxicities such as exposure to polychlorinated bipheноls, PCBs, to play a role in the pathogenesis of hypothyroidism. Unfortunately, misdiagnosis is common in the management of hypothyroidism. If you go to a doctor with hypothyroid symptoms, you'll simply be given replacement hormones without any further inquiry into the cause of your condition. Autoimmune hypothyroidism, also known as Hashimoto's disease, is a condition in which the immune system begins to attack the thyroid gland. Hashimoto's is the most common autoimmune condition in the US, affecting between 7 to 8% of the population. The standard of care for Hashimoto's treatment falls quite short of a holistic approach to medicine. In fact, most conventional practitioners will wait until the patient's immune system has destroyed enough thyroid tissue as to warrant thyroid hormone replacement therapy. Seeing as Hashimoto's is typically coupled with other autoimmune conditions such as celiac disease or pernicious anemia, it is quite perplexing that the conventional medicine paradigm has not taken the time to investigate the underlying causes of thyroid disorders. For example, the molecular structure of gliadin, the protein portion of gluten, is almost identical to thyroid tissue. If a patient experiences an autoimmune reaction to wheat, it is not unlikely that the antibodies to gliadin will also attack the thyroid. For example, the molecular structure of gliadin, the protein portion of gluten, is almost identical to thyroid tissue. If a patient experiences an immune reaction to wheat, it is not unlikely that they will produce antibodies to gliadin that will also attack the thyroid. Hyperthyroidism represents the other extreme of thyroid function. This occurs when the thyroid becomes overactive, producing too much thyroxine. Graves' disease is the autoimmune form of hyperthyroidism. Symptoms of hyperthyroidism are quite the opposite of hypothyroidism. They include excess sweating, excess hunger, heat intolerance, abnormal heart rate or rhythm, irregular/light menstruation, nervousness and anxiety, exophthalmos, which is a protrusion of the eyes, insomnia, irritability, weight loss, and hair loss. It should be known that thyroid conditions only increase in light of metabolic issues such as diabetes or PCOS, polycystic ovarian syndrome. Inherent in metabolic syndrome is a cascading effect of insulin resistance, inflammation, and hormonal disruptions that undoubtedly affect the thyroid gland via hormonal interaction with the pituitary gland, affecting conversion of T4 to T3 and more. All right, thanks for riding with me through part 1 of the series, and I'm looking forward to seeing you all next week for part 2.